Welcome to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. Metformin is one of the most prescribed medications in the world. For decades, it has been the first-line treatment for type 2 diabetes. It lowers blood sugar, helps with weight management, and is generally well tolerated. But in recent years, researchers have started asking a much bigger question. Could metformin also lower the risk of cancer? The idea is not as far-fetched as it sounds. Scientists have known for a while that people with diabetes have a higher risk of certain cancers, and some studies have suggested that metformin might reduce that risk. But is it true? Is the evidence strong enough to recommend metformin for cancer prevention? Or is this another case of hype outpacing the science? We are going to look at the latest research, including a major 21-year clinical trial published just last year. We will break down what the data actually says, where the evidence is promising, and where it falls short. Segment 1. How metformin could affect cancer risk. First, it is important to understand that type 2 diabetes itself is associated with a higher risk of several cancers, including colorectal, pancreatic, liver, breast, and endometrial cancer. Researchers believe part of that connection comes from chronically elevated insulin levels, chronic inflammation, excess body fat, and long-term high blood sugar. Insulin does more than regulate blood sugar. It is also a growth signal. When insulin levels stay high for years, as they often do in insulin resistance, that may create an environment that encourages abnormal cell growth. That is where metformin enters the conversation. Metformin works primarily by activating an enzyme called AMPK that tells cells to use energy more efficiently and slows down energy-intensive processes like rapid growth and division. AMPK activation also suppresses another pathway called mTOR, which plays a major role in cell growth. Many modern cancer drugs target the same pathway directly. Metformin may also lower circulating insulin levels by improving insulin sensitivity. That matters because lower insulin exposure could theoretically reduce growth signals that some tumors rely on. And finally, metformin appears to reduce chronic inflammation and oxidative stress, both of which are linked to cancer development over time. Segment 2. The 21-year clinical trial, 2025. The most important study to date is called the Diabetes Prevention Program Outcomes Study, or DPPOS. This was not a small or short-term study. Researchers followed more than 3,200 adults at high risk for type 2 diabetes for an average of roughly 21 years. Originally, the study was designed to test whether intensive lifestyle changes or metformin could delay or prevent type 2 diabetes. But because the study lasted so long, researchers were also able to examine cancer outcomes over time. The cancer results were published in 2025. And here's what they found. Neither metformin nor intensive lifestyle intervention significantly reduced overall cancer incidence compared to placebo. The hazard ratio for metformin was about 0.90, which suggests a roughly 10% lower cancer risk. But the result did not reach statistical significance. That phrase matters. Not statistically significant means the researchers could not rule out the possibility that the difference happened by chance alone. In other words, the study hinted at a possible benefit, but it was not strong enough to prove one. Researchers also looked at obesity-related cancers specifically, because obesity and insulin resistance are strongly linked to several cancer types. Again, there were trends suggesting possible reductions, but nothing definitive enough to establish causation. This is important because DPPOS is considered a gold standard randomized controlled trial. Unlike observational studies, participants were randomly assigned, which greatly reduces bias and confounding factors. And despite more than 2 decades of follow-up, the study still did not produce conclusive evidence that metformin lowers overall cancer risk. Segment 3. What the Meta-Analyses say. One 2025 meta-analysis, involving more than 1.4 million participants, found that metformin use was associated with about a 20% reduction in colorectal cancer risk. The analysis also suggested that longer duration of use was linked to greater benefit, with risk dropping modestly each year metformin was used. Another large analysis looked at pancreatic cancer, one of the deadliest forms of cancer. Researchers found that metformin users appeared to have a lower risk compared to people taking older diabetes medications like sulfonylureas or insulin. But when metformin was compared against some newer diabetes drugs, the advantage became less clear. A broader review of 18 studies involving more than 1.3 million people found that metformin use was associated with roughly a 10% reduction in overall cancer risk. However, the same review found little evidence that metformin improved survival once cancer had already developed. That distinction is important. Preventing cancer and treating cancer are not the same thing. A medication might modestly reduce the odds of developing certain cancers over many years, while having little effect once a tumor is already established. And this is where headlines can become misleading. A study showing a 20% reduction in risk sounds dramatic, but depending on the baseline risk, the actual reduction for an individual person may still be relatively small. So the overall picture is mixed but intriguing. Metformin may modestly reduce the risk of certain cancers, especially colorectal cancer. But the evidence is far from definitive, and it does not appear to function as a cancer treatment itself. Segment 4. The bottom line for you. At first glance, the research on metformin and cancer looks contradictory. Some studies suggest meaningful protection, while others show little or no effect. But the disagreement may come less from the drug itself and more from how the studies are designed. People who take metformin are often different from non-users in important ways. They may have better blood sugar control, healthier lifestyles, more medical supervision, or earlier disease detection. Also, cancer can take decades to develop, while a person's weight, medications, smoking history, and overall health may change repeatedly during that period. So the mixed results do not necessarily mean the science is unreliable. It may simply reflect how difficult it is to isolate the long-term effects of a single drug on something as complex as cancer. So where does all of this leave you if you are currently taking metformin or considering it? The bottom line is that the evidence suggesting metformin may lower cancer risk is promising, especially for colorectal cancer. But it is still not strong enough to recommend metformin purely for cancer prevention. Taken together, the research suggests that if metformin does reduce cancer risk, the effect is probably modest rather than dramatic. In other words, metformin is unlikely to be a cancer prevention drug, but it may provide a small long-term advantage alongside its proven benefits for blood sugar control and insulin resistance. So if you already take metformin for diabetes or prediabetes, the possible cancer benefit may simply be an added bonus. But based on current evidence, there is not enough support for someone without diabetes to start taking metformin solely to prevent cancer. And it is important to keep perspective here. Even if metformin eventually proves to modestly reduce cancer risk, the biggest drivers of cancer prevention are still the fundamentals: maintaining a healthy weight, staying physically active, avoiding smoking, limiting alcohol, eating a balanced diet, and keeping up with recommended screenings. There is no pill that replaces those things. Metformin remains one of the most important and well-studied diabetes medications ever developed. But when it comes to cancer prevention, the science is still evolving, and the real story is probably one of modest benefit rather than miracle protection. Segment 5. Final thoughts. Metformin is one of the most studied medications in modern medicine, and its benefits for type 2 diabetes are well established. The question is whether those benefits extend beyond blood sugar control and into cancer prevention. After decades of research, the answer appears to be possibly, but not dramatically. The many observational studies are encouraging, and there may be a modest reduction in risk for certain cancers like colorectal cancer. But in the end, the biggest tools we have for lowering cancer risk are still the fundamentals of exercise, nutrition, maintaining a healthy weight, avoiding smoking, and staying current with screenings and preventive care. So if you take metformin for diabetes or prediabetes, its proven value is still blood sugar control, insulin sensitivity, and long-term metabolic health. Any cancer-related benefit, at least for now, should be viewed as a possible extra, not the primary reason to take it. What are your thoughts about metformin? Comment below and please share this video with someone who needs it. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.